Good evening. Hello.
Hello,
How are you doing?
I'm fine. Charan, how about you?
I'm doing good too, Saba. I think your video is slightly freezing. Am I audible? Am I visible clearly to you?
Yeah, you are. How
Okay.
about now?
Yeah. Great, great, great.
Okay.
So, so hello everybody. We have Dr. Saba with us. She's
Hello,
working with
everyone.
Yeah, she's working currently with the state of Gujarat. Um, she is a doctor who has done her MD in preventive and social medicine. So actually want you to tell, what do you do?
Well, as Dr. Charan has told that I have done my, like we both have done our MBBS together, so that's how we are colleagues. We know each other. Followed by, I've done my MD in preventive and social medicine, and I have joined the government of Gujarat under the state for RI consultancy. And right now, I'm working for the government of Gujarat under UNICEF.
UNICEF sounds very exciting
Well, it's a job.
to me. It is. Yeah. So today, why I wanted us to collaborate and speak is because everybody is talking about how to treat anxiety, how to treat depression. I thought, why not go little back and try to prevent it, so you can have a more better quality of life.
Coming from a public health point of view, where we deal with the budget and the draft and the proposals, I would say that preventing mental disorders is cheaper than sitting on the treatment. I mean, why not prevent it in the first place?
Yeah, 100%.
So,
Preventing any health condition is definitely way more cheaper. Um,
mm,
Also, I think a lot of people keep thinking that psychiatric problems means you need to have a problem. You need to have like a family issue, or you need to have like a breakup, or you need to have a financial loss or something like that, which is not true at all. So I thought like we should go a little bit in depth about what are the preventive strategies, or what are the risk factors rather. I thought we can talk about that as well today.
yeah, it's about the knowledge of what mental disorders are in the first place. I think you are the better person to tell like what exactly comes under mental disorder. You don't have to be mental per se, literally, to be called as a person with mental disorder, or you can just say some mental problems, I guess. So I think if ever you relate to someone with, just being sad for a day, or just being not in a mood, or I'm not like my normal self, then I would still call it as a mental disorder. And I think you're the best person to tell, to begin with, what is mental health disorder in the first place. So go on, Charan, you tell me what comes under mental disorder.
Yeah, I mean, once in a while feeling low is very normal. I mean, that's pretty normal. Just like how once in a while we all have headaches, and they all don't have to be migraines. Or once in a while we have stomach irritation, probably because of the food that we ate. It doesn't have to be a gastroenteritis per se. Once in a while having mood fluctuations and symptoms are very normal, especially for women because of the constant uh, whiplash of the hormones that they go through every 28 days or 21 days. Um,
Nothing to get offended, ladies. If
no,
someone
I mean,
tells
it's
you,
good
do
to
you have
know.
PMS?
It's good to know the reason where it's coming from. So we actually
I know.
did a talk last Wednesday, about premenstrual syndrome. I'm not sure if you followed. So that spoke.
I think
Yeah. Yeah.
it
So
was something people label if you're just irritable. You just put it on the hormones. Not really. I don't think you can blame hormones for everything what a
yeah,
woman goes through.
that's true. That's true.
Oh,
Yeah. So mental health disorders are obviously brain conditions. Um, Per se, you must be having some insult, or insult as in not English insult. You know what insult is. Insult is any trauma or any infection or anything that occurs to the brain that can either manifest in physical form or psychological form. It depends, you know. Brain illnesses can be physical diseases or psychological diseases. That's why we have neurology and psychiatry. That's how you get the diseases. Secondarily, how we get diseases are any other physical conditions. For example, understand that our body has multiple organs. You don't just have one organ. So all these organs have to work synonymously together, so you have better health. When one organ fails to work, for example, you're drinking alcohol and your liver fails to work, and it's not doing its function. So liver's function is detoxification, meaning converting toxic material into like a non-toxic material. When liver is not able to do that, these toxic materials which are excessively produced, they will go and reach brain. So you can have seizures, you can have hallucinations, etc. So you can't just tell that, you know, you're mental or anything like that. You know, it's primarily because of, you know, two organs not interacting collaboratively together. You know, that's the reason. That's how you get mental health conditions. So people think, you know, people don't think of any of this, because I understand they're not doctors, but they think that, oh, I'm depressed because I had a breakup. But understand, if 10 or 100 girls or boys have had a breakup, not everybody goes through depression. Only a couple of them go through depression. What is the reason? You know, that we're going to discuss now.
I feel there are a lot of risk factors. Your reason being why out of 100 people, or only 2 or 4 people, or maybe just 20% of them actually feel depressed with a mere heartbreak, or with just loss of a job, or just failing in an exam. Why do you think that happens? Apart from your body moving in synchrony, what do you think are the risk factors? You know, like there must be a lot. Like everybody's family or everybody's life is kind of different. They all have various socio-economic status, and you know, they have different prospects to life. So I think you must be a better person to tell me, like, what are the risk factors apart from your body being one in synchrony for mental diseases? So you let
Um,
us know.
so, you know, I mean, I don't know if you will be surprised or not, but a lot of you will be surprised that, you know, a lot of psychiatric conditions, the onset is when you are not even born, when you are in your mother's womb, right after, uh, you know, when you're growing up, the 9 months in your mother's womb, it's called intrauterine life. That's where the risk factors can start. That can decide if you'll have any kind of neurological or psychiatric problems in the further life. For example, genetics, obviously, we'll start with genetics. Genetics play a huge role in neuropsychiatric conditions. When I say neuropsychiatric, it's both psychiatric and neurological. But again, these are not absolute genetic diseases. What I mean by that is, if my mother has a particular condition, there is no 100% necessity that I'll get it. You know, I am at definitely higher risk than probably you, who have a parent without that particular psychiatric problem. So I'm at higher risk. Now, I am born with a higher risk than you. I'm just comparing you and me. Let's just say my mother has had clinical depression, your mother doesn't, and I'm at higher risk than you. Now, we both went to the same medical school, right? And we are friends for quite some time. Let's just say we both are using a drug. Let's just say we both are getting addicted to drugs, or we are in a very high stressful environment. Now the tipping point is that, you know, I might be going into clinical depression and not you. You might feel low for a couple of days and you might be normal. Normal as in you might become fine. So that genetics play a huge role in deciding, you know, who are the people who are at higher risk. Now, when I say genetics, a lot of people tell me that, oh, but my mother never had any psychiatric problem. Understand that it doesn't have to be a psychiatric problem. One gene can manifest multiple diseases. It's called gene pool. For example, if I have a father who is a hypertensive, I don't have to have hypertension. I can have anxiety disorder, right? If my mother had diabetes, I don't have to have diabetes. I can have an eating disorder. So multiple diseases, they work with the same gene pool. So that, for example, if my mother has seizures, I can have alcohol dependence. Both are completely different diseases, but they can occur together.
Yeah, coming on to alcohol, mother issues, and home, I think you can throw light more on the non-scientific part, or what you can say, the socio development part of psychiatric disorders under these initiation of mental disorders in early child development. I think I would want you all to know that UNICEF has been working on a experimental approach, like a lab based approach on how the early child development can actually affect the mental development in a child. And as you have said, as Dr. Sharon has told, that the mental disorders or the mental condition of a person or of an adult actually starts very early in life, and it's much before 2 years of age. And a lot of funding and a lot of projects are being done under UNICEF on how treating a child at the early age as low as 2 years can actually affect mental health of a person. And it's been proved by doing multiple MRIs on a child's brain below the age of 2 years. And any approach or any developmental approach done after the 2 years or after the damage done is actually not doing any help to the person. So anything below 2 years is actually very, very crucial to a child for his development much later in his adult life. So I hope you all have a very good childhood, and I hope you in turn in future actually put an extra effort in dealing with a child who's less than 2 years, so that his mental health in adulthood actually makes a difference. So as you said, Charan, those are one of the few factors where UNICEF is also involved in mental health aspect.
Yeah, I mean, very rightfully said. Also adding to what you said, not just you dealing with your child, but also you, when you are pregnant itself, the care that you have to take, or anything that you do will affect your child, and obviously your child more than you, because obviously baby is like still developing and still forming. There are various risk factors. For example, one of the highest thing, even UNICEF deals with it. It's called fetal alcohol syndrome. There is a great rise in women alcohol users, in today's day and age. That's the reason why there is much increase in mental retardation cases. We call it intellectual disability. This is where the people are born with low IQ. For people who don't know what is mental retardation, it is because in English we all keep scolding each other as, "Are you a retard?" It's a very wrong word to say. Retardation is when your brain is not growing beyond a certain age. For example, I have a 40-year-old patient who comes and calls me uncle, because her brain still works at much lower level or much primitive level of, when I ask her age, "What is your age?" She says she's 7. She's 40, but she says she's 7. So understand the brain stops, or very slowly it starts growing, which doesn't catch up with any of the other people. So one of the first thing is maternal alcohol use, maternal smoking, even paternal, because there's something called passive smoking as well. The father is smoking, in the same environment, that can be a big cause too. Advanced maternal age, because we are also career oriented, and most of us are not ready to have children, unlike the olden days. I understand, it has a good side also, but the downside is that above 30 years or above 35 years is in more higher risk to have a child with mental abnormality. But a lot of people ignore that, maternal age is not the only thing. Paternal age is also important. Men will escape this very, very smoothly, but it's not as important as maternal age. But paternal age is also very important. Anything advanced is at higher risk. Exposure to any infections or any kind of unnecessary medications also can be a high risk for pregnant women to have children. Even having as simple thing as pets in the house could be a risk factor, especially cats, because something called toxoplasmosis is an infection that occurs through cats, and that can affect your baby's brain as well. These are a few things that can occur. And let's just skip to now that baby is out of your womb. Now what? Also, before that, while you're in womb, if the mother is subjected to any kind of abuse or violence or neglect from the family, from be it husband or her own family or her in-laws, that could cause a child to have mental health conditions as well. That is very, very important. Being pregnant.
I would like to add something called social and cultural practices. you think it's just the mother or, what she faces in the family. I think that has something to do with culture and, society as well.
Yeah.
You could throw some light on that as well, especially being in a place like India and women's health, women's mental health. What is your say on that?
I mean, unfortunately, venting out is not very easy. If I look at the quintessential middle class woman who is 28-year-old living with in-laws, she can't vent out. The moment she vents out, her in-laws will say that, I was pregnant much younger to you. Your husband was born to me 10 years, 10 years when I was 10 years younger to what you are right now. So that kind of thing can shut the women's emotions. So they will go through a lot of psychological abuse. We were talking in the last discussion also, psychological abuse is a very big thing. You don't have to beat a woman up. That's not the only abuse. Psychological abuse and tormenting, harassment, all these are extremely important.
You're supposed to bear that. You're a woman. You're an in-law. You're a daughter-in-law. You're supposed to bear all of it. It's something out of guilt. A woman has to do it. Just, if anything done otherwise, she's supposed to be selfish. And that she keeps beating herself up, being hard on herself. And that actually, she starts becoming submissive and starts isolating herself. I've seen a lot of women doing this. And ultimately she breaks down mentally. That can actually cause a lot of mental disorders, I believe.
To her and to the child as well, 100%, not just to her.
Another thing that she's pregnant. Yeah.
Also, someone who is not taking enough nutrition is very, very important to have a child with a mental health condition. That is very important as well. Also, once the baby is born, neglect. A lot of people think that, oh, baby is very early, baby will not understand anything. It's okay, let me neglect. No. Because understand this, I'm 30. Most of my brain developed only in the first 2 years or maximum in the first 6 years. Beyond 6 years, brain doesn't grow. If you want proof for this, you can check your head circumference. It remains the same after 6 years, no matter how big you're growing, how tall and how big you grow. Head circumference remains same because brain stops growing after 6 years. But what happens after 6 years is brain starts adapting, rewiring, removing unnecessary information. It starts shaping up. It starts. It's called pruning, and it's called pruning in medical language. That happens. So, as young as you, if the baby is not stimulated enough, when I say stimulated, if baby is not exposed to enough environment, that in Corona times, it could be a risk factor as well. Shutting the baby into.
Yeah, I think that has become a very big major risk factor as of now during the Corona pandemics, where the children are shut down inside and they do not know why. And they are not able to move out. They're not able to talk to their kids. And one more thing I would like to add, as you said, that early child stimulation, it can just be talking to your newborn in your own language for hours together, like you're talking to an adult. Even that can be a child stimulation. You don't have to make childish sounds, or you think that the child doesn't understand, so you do not talk in your own language. You start making sounds and all those things just because it's a newborn. No, it's a proven fact and evidence-based, a fact that if you talk to a child, I mean, a newborn child or someone below 2 years in your own language, you can just explain a paragraph of your medical textbook and it would still be a mentally stimulating factor for the child's development. So I think Charan must be knowing that it's called early child development, and the child stimulation can work as well. You can just start talking to the child like you talk to any other adult. Even if the child doesn't understand, the brain is getting stimulated somewhere down the line.
Yeah. I tell everybody, I tell all the mothers, don't think the babies are dumb or anything like that. Babies grasp everything at a much faster rate than what you and me would. Expose them to multiple colors, expose them to multiple textures, let them feel different textures, even though they don't understand, doesn't matter. All that helps brain wires in a better way. Parenting is a big task, it's not easy. So, you have to be dedicated. Now, what are the other risk factors for the child to have mental health problems? One is physical abuse, verbal abuse, sexual abuse, which is very, very high. You think it doesn't happen. It happens a lot. Sexual abuse not just happens with women child. You'll be shocked to know it happens more with a male child, because you don't doubt as easy as you would doubt if it happened to a girl child. It happens with mostly your relatives. It's not going to be somebody walking on the road. It would be it would be somebody from your neighborhood, somebody from your friend circle, somebody from your own siblings. You know, we have seen over and over again and heard horror stories. All this does affect child's mental health in the further life as well. So don't think that oh, but the baby didn't know anything. What went through the child? That's not true. It does affect. I don't know exactly how it affects, but the research clearly showed a big margin of people who were abused coming with much mental health conditions than the ones that did not. So that is very, very important. Even emotional neglect, which is very common and not talked about. If you're not providing enough emotion for your child, especially it happens in some families where you have multiple children. Because you end up getting vexed to focus on children, and you just let them be. You let them fight, let them fall, let them drop down. That's not going to help.
I'm sure a lot of people might have known such families where there are a lot of the birth order is 2+. That means the number of children are more than 2 in number in a family, or they are 4+ more, where the mother is not able to provide nutrition to herself nor for the other children, nor the father is able to provide to everyone. So somebody's education is cut off because of the financial issues. He starts working as soon as he grows up, maybe just 15 or 16, and he's not able to, the parents are not able to provide that emotional contact what they need. If he's going through something in his mind when he's an adolescent, he would need his parents attention a lot, but they're too busy taking care of the smaller kids. These things must be so common in Indian families, where in future they do not open up to their parents, and they open up to the peers, and they end up doing all this. Like, it's another topic called substance abuse, which starts right from the family, like right from adolescent or right from the childhood. They face so much, and they cling on to something where they can just vent out doing something which they don't know is going to create so much of consequences in the future. So I think that's one of the mental disorders in itself.
Yeah, I mean, I tell a lot of fathers. Yeah, I tell all the fathers that you're drinking alcohol. Don't think your child doesn't know it. There is very good likelihood of that your child becoming an alcohol dependent person himself. So you're indirectly ruining your own health and your own child's health, which is not going to do any good for you in the future. That is one thing. Now that I don't want to make it all about. Sorry. Yeah, go ahead.
Apparently, the children are the mirrors of the parents. Like, whatever the parents do, they're going to mirror the same thing. They think that's normal. Like physical abuse, domestic abuse to the mother, he thinks it's normal because it's going on in his house every day. So he thinks that it's normal to hit his wife. When he grows up, he would want to hit his wife, and he thinks that's normal to make his wife submissive, or make his wife shut up. So it's something which the parents have to think in the first place. I think the prevention of mental disorders would start from the parents. I mean, to be honest.
No, 100%, 100%. We spoke about genetics, right? There are adoption studies that showed that you're born with great genes, fantastic genes, but you're adopted into a family which is very dysfunctional, which is broken or divorced. But not all divorced families are unhappy, but some are. They can come down with a lot of psychiatric problems as much as what the genes would do, or even more. So what you're saying is very true. Parents play a huge role in your health, right? Also, for now, moving off from the children to adolescents, what are the risk factors? Would be first is sleep deprivation. I can't emphasize enough about the importance of having sleep. You don't have to sleep early and wake up early. That is a fantastic way. But if you're not, at least stick to your sleep timings every day. Don't be erratic with your sleep. Don't do that. I know it's very exciting to stay up and watch Netflix and things like that. No, you will be more prone to be developing psychiatric problems. That causes a lot of burden on your life. Understand that. Second,
I think not only Netflix, I think it's a social media. Social media is a topic in itself.
Yeah.
For adolescents and social media.
Yeah.
That should be another topic.
Yeah, that indirectly causes sleep problems any which ways. Along with the substance use, I think the number of cases in psychiatry is increasing very high only because of, I would personally, if you ask me, it's mainly because of 70% because of drug abuse. Everybody drinks alcohol, everybody smokes. If you don't, you're the uncool or unpopular person. So the feelingness to belong to somebody, with somebody, and to look like a cool
I think we
kid
need to start a motto.
Yeah.
I think we need to start a new motto, like how you are vegan. Before you're a meat, if you are somebody who eats meat, you're cool. but now being vegan is so cool. So how about we start a motto like, it's cool to be uncool? How about, it's cool to be uncool? Why don't we start a adolescent movement like that? It's
Yeah,
okay. It's okay if you don't smoke.
yeah,
That's cool. You're being different. How
yeah,
about that? I
yeah,
don't
yeah,
smoke. I don't drink alcohol. I'm cool.
yeah. Yeah, I mean,
That's the, I think, one
rightly
of
said,
the,
rightly said, because I know
yeah.
that
So
people don't
let's start
understand.
a trend.
Yeah, people don't understand the impact that
Let's,
drugs can have on us. Because I was talking to one of the patient, and he's telling me cannabis doesn't cause any addiction. I read it on internet. I said, you read on internet. I
and
studied for 11
feel,
years.
I feel the age at which you're, I feel it's the age at which you are exposed. There's the vulnerable age of adolescence where you get attracted to everything. And then you have an age where you're quite wise, you know what's wrong and right. Maybe the age at which you're exposed, or where you know how to take decisions also matters, especially when you're with your peers. You say you are exposed to drinking and smoking at the age of 16 versus you are exposed to drinking and smoking at the age of 25 plus or 30 makes a lot of difference, I guess. I think you should be, I guess you're more
No, definitely.
expert in
No,
this, in
definitely.
trying to about this
That's the reason
age
why
of conflict.
legal age for drinking is there. That's the whole point. Why is that
Exactly.
age? But again, I don't know how
Exactly. That's
mature
the
a
extent
21-year
of,
old. Yeah.
yeah. That's the explanation. That's why whenever there are policies, I would like to tell you all that policy is just not writing something on the paper. It's all evidence-based approach. A lot of experiments are done and we get the results, and that's when the government of India, with all the expert advice, makes policies and legal applications so that it becomes a document, or what you can say, a legal thing. That's when it happens. It's just not you see some cut paste, or you just follow something just somebody writes. No, it's all based on evidence. A lot of work, a lot of expert advice, a lot of funding goes into these projects to see why smoking causes this, and what happens if you stop smoking here. What's the best, what is the best solution to reduce the smoking on a national level. It's all tried and tested, and with evidence these documents have come up, and that's how the policy for prevention of mental disorders come up. So I would like you all to know that the policy of mental prevention of mental disorders have been done after so many solutions have come up, and the best of the solutions come out, which is feasible and which is affordable, accessible to the public health. It's not like only the most richest person can access to these kind of mental health treatments, or only the elite class or someone who's educated can only have access to these counseling sessions. Now they are trying to make, because mental health has become something not the elderly or not the ones who are very rich can face. The mental health disorders can be faced by anyone, from as low as young as a 5-year-old kid, or as old as 75-year-old, or you can say if it's a female or a male, or if he's rich or poor, anybody can have mental disorders. There's no discrimination whether he's rich or poor, that you can have mental disorders. So that's why it's become a public health problem now, because anybody in the public can have mental disorders, and that's why we need to have policy for prevention of those at a very young age.
Yeah, we will get into the policies slightly in a couple of minutes. Uh, like you rightfully said, not everybody can afford mental health care. That's the reason why I wanted to collaborate with you, so people know that counseling. Because every patient tells me, when I say I'm giving you medications, I'm sending you to counseling, they're like, how much would the counselor charge? I would say around maybe 1,500 or 2,000 per hour. They say that somebody who makes 5,000 or 10,000 or even 20,000 for that matter, it's difficult. It is very difficult. Even for me, if I have to go for like 5-6 sessions, it's going to be a drain on my money for sure. I have to forego or let go of some things. So I know I want us to discuss on that. And the last two risk factors when you are in adult life, one is obviously, or before that, two more risk factors is, one is bullying. People who get bullied are definitely at high risk for developing mental health conditions than the ones who doesn't. That is one thing. And in homelessness and school dropouts and job dropouts are also at higher risk. When you are in adulthood, what are the high risk factors is, again, love failure, breakups, or being in an abusive relationship or abusive marriage for that matter, or unfortunately even homosexuals, they go through much higher prevalence of higher mental health conditions, mostly because of depression and anxiety is higher because of no acceptance in the community. These are the high risk factors. Now I want to, even I'm curious now to know about the policies. We discussed about the preventions, what are the risk factors. I want us to talk in terms of 4 different policies, right? 4 areas. First area is, we're again going to go from children to adults. For children who are born with mental retardation or with intellectual disability, we obviously assess all the risk factors, and I do an IQ, or I send for an IQ assessment. Now, what are the benefits of getting IQ assessment done?
Okay, so basically, I would like to tell, as you have mentioned all the risk factors, if you try to see that nobody is, immune of mental disorders. You said that when the person is born, when the person is pregnant, when the person is a small child, when the person is adolescent, when the person is old, when the person is an adult. So nobody is immune of mental disorders. So starting from a person who's born, neonate, you can say just born baby, or maybe somebody who's a toddler, maybe 2 years, 3 years, you get to know that there's something not normal about a child. Obviously, you have all those standard guidelines, or somebody who's at home would tell you that this is not normal in a child of that age. Maybe he's not speaking well, he's not, there are some guidelines, what is normal and what is not normal. So when it comes to that at a child level, if you want to assess somebody who's having a low IQ, or there are guidelines for the government of India, which is called disability assessment guidelines. Okay, the latest being I think updated on 1st January 2018. There are some 21 notifiable diseases which come under those, and if there are guidelines, you can follow this, and the assessment is done even at the hospital level. You can assess a child with such problems even at a school level. The teachers are also trained in finding out whether the child is having learning disabilities or not. So disability doesn't mean that a person is having a broken arm, or he doesn't have an arm or a leg. It can be mental disability as well. So a small child having problems, I hope you have seen the movie Tare Zameen Pe, where the child is having, autism, I think some learning disability, dyslexia or alexia. Yeah. So dyslexia is a problem where the person is not able to understand the signs and, the written parts, is not able to join 1 and 1, 2, is not understanding the logic between it. And also, if the patient, or if a person is having some mental disability at the school level, the teachers can detect it because they are trained to do that. They also get certified because they are all under notified diseases under mental disability. And the state government as well as the national government can actually provide you with all the facilities which is needed, that is extra counseling or any kind of, it's from the Ministry of Social Justice and Employment, where coming on to your social rehabilitation or medical rehabilitation, if ever needed, once you're notified under the 21 diseases, which is, it is under the government help, you can actually go ahead and, avail all the services under it. And if the person is mentally retarded, we do not call it mentally retarded anymore. We just call it low IQ. So if you have a low IQ, there are counseling and training sessions. And if the child is having any other deficiency or any other disorders up till the age of 5 years, they all come under a program called RBSK, that is Rashtriya Bal Swasthya Karyakram. There are 8 types of disorders which all come under those tables. And if you have any one of those, you can definitely go and avail all the services free of cost. It includes counseling to the child, okay, and there is a psychiatric department and a psychologist help which can be provided at the government college level as well. This is something to do with the children. So all these services can be availed at the government level, at the PHC level. The basic things can be done at a primary health center level, after which you will be referred to specialist care. The specialist care starts from community health center. The primary health care center, as you all say, it's only primary, where early detection can be done, or at a school level. And then after that, any specialist care is free of cost at community health centers.
So I even heard of, not heard, I know that, people with low IQ, once they get their IQ levels tested from a government center and they get a certificate from the government, they have pension money that they can live on because, they will
Yes,
be
it
aspirate
can,
to like, yeah.
not only physical disability, but even mental disability, disabled people can avail some kind of a financial help, and financial help, as well as all the help and psychosocial help as well from the hospital. Registered under those programs, you can definitely avail those pensions, which can be used for their other aspects, or even some people can avail, if they are normal enough, they can do basic things on their own. Some vocational training is also given. They can definitely avail some employment on a very meager level. They can at least do something and be independent on their own. So there are a lot of things which you can avail from RBSK and from the Ministry of Social Justice and Employment.
Okay. Okay, that sounds fantastic. And even with people with low IQ, when they have an IQ assessment done, their pass percentage in the examinations also is cut off much lower. For example, if I have to, considering I have normal IQ, or regular IQ, and if I have to have 50% to pass, people with low IQ might be given 30% or maybe even 20% for that matter, and they will be eliminated from writing exams, or maybe they'll be eliminated from different forms of examinations, or a particular subject also which is not as required for them. So these kind of facilities government definitely provides. Yeah.
Definitely, this is one of the things what you have seen, what can be seen in students with learning disabilities. Once they are certified, their percentage of passing will be actually lower compared to normal people, just because they have those conditions where they cannot solve the problems normally like normal children, or they cannot answer the questions normally like other children, but they can to some extent. So the pass percentage is completely definitely lesser than what normal people have to go through to pass. And it comes with physical disability as well as mental disability and learning disabilities. But however, I would like to tell you practically, when it comes to girls with such kind of disabilities, there is a social or cultural aspect to it. I'm talking to you at the field level. So I have been there, I have assessed the children at the school level, but the parents of such female children refuse to get it certified, and because it's a written document, they feel it can affect the future.
Because it could?
Need to accept them and appreciate them the way they are, and do not discriminate them, at a society level. People do try to do all these things and do not avail the services, just because it might affect them in the future, when it comes to marriage or employment.
Mostly marriage, nothing else. Mostly marriage.
Marriage, employment.
Yeah. True. That's sad. That's really sad. I mean, we are in 2020. Maybe it's the right time for the world to end.
Exactly. It's high time that people accept them the way they are, because it's not something which they have done on their own or something which they have done deliberately.
True.
I think it's high time people understand that.
Right. So that is about children. My second area I want you to inform a little bit about is maternal health, pregnant women, because not everybody can afford going to a elite or posh hospital and getting their antenatal checkups or antenatal yoga and all that. What about other people who can't afford? What about them? What are the services government provides?
When it comes to government services, let us talk about somebody in a very far off village area, where there's no access to normal healthcare. Forget about mental healthcare, normal healthcare, where they have to walk so much to a sub center or a primary health center. So having basic physical health, healthcare is difficult. And how about the mental health care, where she's already having those risk factors like physical abuse, mental abuse by mother-in-laws and all those things. That's a right thing actually, because antenatal mental health care is equally important compared to postpartum as well. Everybody knows about postpartum postpartum mental health disorders in pregnant women or somebody who's delivered. And so I think the government of India has already initiated something called Ayushman Bharat. It's a policy as well as a program. It's also an insurance policy which includes mental health as well. And they have these programs, they have these centers. They've turned these primary health centers into health and wellness centers. So health and wellness centers will include mental health care as well. There are a lot of tests which are done, which are mandatory to all the women who are pregnant. So the antenatal mental health is also one of the components where the doctors or frontline workers at a very lower level are trained to detect mental health illnesses among pregnant women. If the specialists can't come to an outreach area, the people in the outreach area are being trained by the specialists so that they can detect at a very initial stage. Yeah. And then whatever happens later, if it is too serious, it's being referred to the district hospitals or the CHCs where the specialists can take care of them, if it goes very serious. So these antenatal mental health illness are one of the components of Ayushman Bharat. And also about postpartum depression, there are these ASHA workers and Anganwadi workers who go to the houses. Imagine if you are a tribal and you're staying, like, you have to use a boat and you have to go through a boat and then walk some distance, somewhat like a Swadesh scene where you have to use so many transports to reach your home. The same way the tribal areas, because in the state of Gujarat, there are about 17 districts with tribal areas, and they're all at a very different areas. And they have to come once a month only to the primary health center because it's very difficult to reach that area. So what these Anganwadi and ASHA workers do is they travel house to house for at least 1.5 months after the delivery to see the postpartum changes in the woman and the child. So the neonatal healthcare and the postpartum healthcare is also included in the government services, and they do go house to house and document anything irregular, or even the mental health care is also included in these services, and these are free of cost. Yeah. This I'm talking about rural health area, rural health level.
But urban area also people can avail these services, right? I mean, it's not...
The urban health area has got urban primary health care center. There are rural primary health care centers and urban primary health care centers. So you can definitely go at a primary health care, whatever basic mental health care services you need, it's done. And then it is referred to a specialist who is working at a CHC, community health center level.
Right. Yeah. Sounds great. Sounds great. I think we just have 10 more minutes. I want us to address quickly 2 more areas in their policies. One is obviously drug addiction, drug dependencies. I was mind blown to see people drinking sanitizers in rural areas because there is no availability of alcohol.
Okay, there's also a combination of
policies there. Sorry?
Well, there are a lot of people who are vulnerable to alcohol and drug dependency. First is the youth. And second is, I think, somebody who is in the middle age or who has started from the youth and reached the middle age with the drinking and the alcohol and the drug dependency. The first is the most vulnerable part, where you can stop right at the root, the grassroots level. We can just remove the thought of having drugs or drinking is your mental status at your adolescence age. So the most of the time spent by an adolescent is in the school or a college. So it has to start from there, to show them what is cool and what is not cool. Yeah. Having drinks doesn't make you a cool person. Smoking doesn't make you an adult already or a mature person. All these has to be taught. And there's one more reason why people start drinking and, smoking is they say everything is stress, depression. I want to just de-stress. How about picking something else to de-stress yourself? If some more options.
No. How about seeing a psychiatrist? This is what I don't understand. Why do you want to either just talk or smoke? Why can't you go see a doctor? That's besides the point. Yeah.
Doctors the realization should come from within, that you need to go see a doctor, and that has to be taught at a school level or a college level, that this is not right, this is not fine, and I think I need to go and see a psychiatrist. You shouldn't think that, okay, my friend has I think she's going and seeing a psychiatrist, so I think she's mad or she's crazy. that discrimination or that stigma itself stops you from going because your friend already thinks you're mad. So the kind of awareness and that kind of, substitution to smoking and drinking are all included in a life skills education, which has already been started. It's something like a moral science period or a physical education period. Now, I'm happy to announce that physical education or sports is a mandatory subject in every school and college. You have to participate. You have to do it. It's not like a part-time now anymore. So that's one of the great things that the new health policy, education policy has included. And trying to know different languages. The new languages have been included. And thirdly, life skills education, which include making your hobby as your occupation, anger management, stress management, how to manage a conflict management, how to face your failures. It's not always attaining success. You don't get success in the first try. You'll have to try and try again. And for that, you need motivation and encouragement. And I think people have to be okay with failing once or twice. So these all come under life skills education, which has started as a module, as a study module at a school level or a college level itself. This is somewhere the adolescent have to take in and try to differentiate between what is cool and what's not cool, and how to deal with your own problems and not to depend on others or anything for all your problems. So this is somewhere your alcohol and drug dependency can be avoided. And we have a lot of the mental hospitals or you can say psychiatric hospitals have got de-addiction centers at the district level as well as at the state level, where you can get admitted for de-addiction. And there's something called rehabilitation. It doesn't end at de-addiction. It has to be rehabilitation, because once you come back, if you're not accepted by the society, then there's no point. They go back. It may it be a terrorist, may it be somebody who is a criminal, may it be a drug addict. Unless you are accepted by the society, you're going back to where you belong. So there's something called midway homes, and there are also the place where they try to get you close to the society in the midway, and then you can join after some time. You have to be mentally ready.
One second. This midway homes is something that is very new to me, because in USA they have midway homes where they shift from the hospital to the midway home and they integrate them into the society very smoothly and normally. Oh, even India has that? I didn't know this. I mean, this is fantastic.
India has, to be honest, India has a lot more than you think. I think Gujarat is one of the states where they have their own mental health policy and their own innovations. And what I can say is midway homes are really, really necessary, because once you come out of that depression pool or you are into an addiction pool, you need to come back, you need to normalize yourself and you slowly get acclimatized to the normal society, because once and for all you get in there, you might have some anxiety issues and you might want to go back to where you belong. You might start, there might be relapse and all those things. So midway homes are really, really important. Maybe a prisoner, maybe a small adolescent, a juvenile delinquent, or it can be an addict as well. So those are some things which are provided, and they are also private organizations or NGOs which are being funded by the government, state government as well. So it doesn't have to be only government enterprises. There are some private organizations which are being funded by the government.
Okay, that's great. That's great. I think we are running out of time. I want to know more about people with geriatric mental health problems, be it dementia. For example, in West, I know that government picks up people with dementia, takes them to a daycare, just like how we take kids to school, right? And let them have activities, interact with other old people, and then drop them back by the time their kids are home. Does India have that? I mean,
when it comes to geriatrics, yeah, there are, like, not all states, I guess. I mean, there are in an initial point, and then you have these infrastructure issues and all, but the guidelines are there everywhere in every state that you are supposed to have something called daycare centers for geriatrics. And if you want a long stay, so if you're considering psychiatric illnesses for geriatrics, or you can say someone who is on a long-term illness or a chronic illness with schizophrenia or anything, you need a long-term, then you will have to be shifted to a district level or a mental psychiatric hospital level. Otherwise, if it's an initial acute incident like an attack or anxiety attack or something, those can be treated at a primary health center.
Yeah.
And if you want a long-term admission, that it has to be done at a district hospital or a CHC. And if you are thinking about geriatric nursing homes, it is at the hospital level. They do not have a, like a nursing home separately for geriatrics as such. It is at the hospital level. There is an exception where private organizations have been funded by state governments, where you have a public-private partnership. They have been doing that, and few states like Gujarat and I think few places in Kerala have these nursing homes which are run by government and which is not in the hospital per se. It's still in a very infantile. And the one more thing is the society and cultural aspects are preventing the geriatric population to be admitted in nursing homes. They think that it's something which you shouldn't do to your parents when they're old, shouldn't keep them in the nursing home, but
it's
not
okay
at the cost of their mental health.
It's okay to
at the cost of their mental health.
Yeah, it's okay to desert your parents and let them be on by themselves, but that is okay. But get
Not
them admitted
send them to nursing home.
That's so stupid.
Yeah, that's a societal thing and a very cultural thing in India, because nursing home will provide you the medical health you need, the mental health you need, and the whatever attention you need by your peers. You'll find everybody of your age. You'll keep talking to them, and maybe there should be an integration of orphanages and these things so that they have some acculturation or some kind of amalgamation with the children.
New family
And
format. Oh, that's fantastic. Oh, that's
I feel they should you should have this. There's an old age home and there's an orphanage. They should be combined together so that they don't miss their grandkids and they get their grandparents' love as well. I think that's something
said. You know
we
what?
need to integrate.
No. Beautifully said. You should be a policy maker for our country. I'm not kidding. I'm not kidding.
Because we do a lot of surveys in old age homes, and we do a lot of surveys in orphanages. And this is one thought which always comes in my mind: why don't we integrate these two? I mean, they must be missing their grandkids. Yeah, I would definitely do it. Make me a policy maker. I'll definitely do that.
That's fantastic. I think that's a lot of light thrown on the policies. So one of the important area, which obviously we don't have time to talk about, is suicide prevention and what are the government policies. Are there enough toll-free numbers or helplines for suicide prevention by our country? But I don't want us to start it and leave it midway. Soon, I think in the next fortnight or 3 weeks, I'll be doing a topic about suicide prevention. I would request you to come at least for 10-15 minutes out of your time and talk.
There are a lot of things to learn. Yes. Apart from India, there are a lot of things to learn from a lot of other countries. Maybe we should discuss that. It's very interesting to know how innovatively they have come up with plans where people in South Korea, people in Japan have come up with something to, just try to prevent suicide at the nth moment, where you feel nothing can help, you just want to end your life, and that nth moment, if something can be done, if you have enough energy to call someone up, or why to do that in the first place, that why to even have that thought in the first place. Maybe we need to have a lot of programs, and maybe we should be open enough to just approach someone in the family. We should be open enough to realize that something is wrong with you and you need to talk to a psychiatrist. Be non-judgmental. Do not judge the psychiatrist. Just let them do their work. They are professionals for a reason. And if you do not like the psychiatrist, you can change the psychiatrist, but you should know that you need a psychiatrist in the first place. And it doesn't happen overnight. To be honest, that's a drawback in mental health, because you take so long to have that thought in your mind, and it takes double the time to remove that thought from your mind. And you should be strong enough from your own side. I'm sure a lot of people might be addicted to alcohol already. A lot of people might be addicted to smoking already. A lot of people might be having issues at home. But how about having a small chat with a psychiatrist just to know your situation, or just to know your status? If you feel something is not wrong, how about having a OPD consultation with a psychiatrist? Not that you need to have something to go and talk to a psychiatrist, but how about getting evaluated by a psychiatrist just to know if you are on the right path? That's also a preventive, it's a preventive mental health. How do you how you do a comprehensive medical health checkup every year. How about doing a comprehensive mental health checkup? How about going and talking to
just comprehensive health checkup that includes every department instead of just
yeah, I
eliminating
think
mental
that,
health.
yeah, I think that should be, one more thing in the policy, added in the policy, that how about adding a mental health consultation with a comprehensive health package in a hospital and
So
get your
our
status
hospitals,
evaluated.
because I work with a super specialty hospital, and they have this mental health checkup as well. But again, like
Yeah,
we're talking about other hospitals and
but
government
sadly,
facilities.
why is it provided only to the elite group? Why not to a middle class man? Why not to a college student? Why don't you have a mental health checkup at a normal medical health checkup level? Why don't we have it at school? Why don't we have, to be honest, mental health checkup, or you can say a psychiatric evaluation, psychological evaluation is done under school health services, where psychologists come and assess the child if he has any violent behavior, if he has any learning disabilities, if he has any issues or attention deficit disorders. These all are checked at a psychological point of view at a school level. However, I think when you are a teenager or something, I think you become strong enough to hide it, or you tend to depend on something else to get the help from. When you are depressed or something, you get into smoking or whatever. So I think teenage is a time when the parents, of course, have to take their children for just a preventive evaluation. That's what I
So
feel.
that
Just
sounds,
to know how your kids are,
yeah, that sounds.
just to know if their kids are okay. And if ever they feel that, there is a perception in children, in the parents' minds, that if you take your children to a psychiatrist, that means my child is mad, or my friends, my female friends will get to know that I took my child to a psychiatrist. I don't think he's mad enough. It's the maternal instinct which says that no, my child is fine, or it's just the early growing up years, he's acting weird, he's gonna be fine after some time. But with this mental health disorder, plus having weird peer pressure, can actually add on to the risk of getting into drugs,
You know,
crime act.
where do I see this problem? I mean, I'm sorry to generalize, mostly in the middle class population, because lower class people, they will come because they can't afford to have a health problem, be it mental or anything. Elite class people definitely come because they have time and money, not necessarily, but
Exactly.
they have resources to fix themselves. Middle class people,
Yeah.
they get up, suck it up, and they move on. That might not be helpful all the time. It will
My
catch up
child
to
is
you
my
in the
child is absolutely fine. My even I was like this at his age. My child is absolutely fine. He'll become fine after when his age is crossed. They blame everything. Even the criminal activity is blamed on the teenage, phase. You can't label a criminal activity as a teenage phase. You can't ignore a small theft or a small spat with his friends, or something which has been going on over a period of time in a teenage boy's mind, and you can't ignore it as a teenage phase. You might have to evaluate it, and it should not be ignored by the parents. That's what is my plea to all the parents who have teenage sons, especially because the girls would tend to just end up being alone or isolated. That's what I've seen from studies. But the boys are someone who tend to end up with, the percentage is high. I'm sure even the girls do it, but I feel the guys have more tendency to get into smoking, drinking, if ignored by the student, if ignored by the parents at this stage.
Yeah. So I
And you
think
need to keep the kids busy.
yeah. So I think our live is ending in like 30 seconds. I really want to thank you. I think the take-home message is, obviously we spoke about risk factors, and early identification is definitely a key for any health conditions, be it mental, physical, anything. And you discussed beautifully about a lot of policies where people are now, maybe people who are watching us can afford healthcare, but they can always help people who can't afford. They can always tell them that these are the policies that some doctor has mentioned. I mean, if one person gets benefited of this talk, I think we both will have a peaceful night, a peaceful life, maybe.
Sure, I'm sure. At least the parents with their children, and even the middle class adults, working women, if they can at least go evaluate yourself psychologically, I think that can do a lot of help to themselves in a long run.